Welcome back to the EIU podcast series on what do young urologists need to know. This is segment 3, where we discuss how to pursue academic excellence in urology. In this episode, we are joined by Associate Professor Juan Gomez Rivas and Dr. Nikita Bhatt. Nikita is doing a fellowship in functional and female urology at Newcastle Tyne Hospital, United Kingdom. Together, they will discuss communication skills and how to prepare for presentations. Join us as we embark on this informative journey.
Hi, everyone. My name is Nikita, and today I'm hosting this EAU podcast. I have with me someone who doesn't require an introduction, but however, it's Professor Juan Gomez Rivas. He's a urologist based in Madrid. He's the chairman of EAU YAU, which is the Young Academic Urologist, and also the Crystal Matula Award winner in 2023. Welcome, Juan.
Thank you for your kind introduction, Nikita. And let's talk about the communication skills.
Sure. So thanks, first of all, for inviting me to host this podcast. This is a topic I have to say that is quite close to my heart, because however many times I have presented nationally or internationally, I always get very anxious prior to my presentations. So my first question to you is, how do you manage pre-presentation or public speaking nerves?
I think first we need to understand why you feel afraid when you are on the stage. Probably because you are in the center of the attention. You feel that you have lack of experience. You have feelings of strangeness, fear of rejection or embracement, fear of looking stupid, fear that your mind will go blind. And you start feeling some, let's say, symptoms, such as your mouth getting dry, nauseous, feel like fainting, your voice will tremble, your legs and your body will shake, and so on. Of course, this can impact directly in your presentation skills. But all the times that you have thought about something could happen while you were doing a presentation that will impact negatively in your presentation, let's say your mind going blind or having a question that you wouldn't be able to reply, how many times did happen? Most of the times didn't happen.
True.
So many times it's something that you have in your mind that will happen, but this won't happen. So this is the first thing that you need to do. You need to relax, and you need to think that the person that invited you to give the lecture have the confidence on you to deliver the message that needs to be delivered. So when you are on the stage is yours, and you are the most expert there to say whatever message needs to be delivered. That's the first thing. Of course, for this, you need to be well prepared. And to be well prepared, you don't have to leave anything for chance. You have to lay out your strategy. You have to ensure that your material is ready. And you have to make some contingency plans. And what is a contingency plans? Contingency plans mean that, for example, if the PPT or PowerPoint or the computer doesn't work, you have to have a contingency plan. You have to have the presentation in your mind or make out some notes, for example. You have to practice your speech. That will be my second advice. You have to speak aloud. You can speak into a mirror. You can record your practice. This will make you confident enough at the time of giving your presentation. You can also practice your presentation with some friends. In that way, you will be closer to the real world, speaking to a group or speaking to someone that you know. Always prepare a safety net. A safety net, this is something related to what I have said before. Just in case your mind go blind, just in case the things doesn't go the way you think it was going to happen, you have to prepare your safety net. That your safety net can be papers, can be cards, can be notes. Probably you will never use them, but it will reduce your nerves. You can reduce the fear of your audience, like visualizing the audience in a negative way or in a positive way. A positive way would be to watch the audience as your friends. If in a negative way is visualizing your audience like they are clowns or they are in funny suits, that will reduce probably your anxiety, but also can make an impact in your presentation. So probably the positive approach of seeing the audience is nicer, to visualize them as your friends. And as I said at the very first beginning, relax, because probably all the things that you think that will impact negatively in your presentation won't happen.
Absolutely. I'm all about positive thinking. That was a very comprehensive summary of how to tackle your nerves. I'm sure we're going to use this in my practice. At the back of what you said, considering you are someone who speaks multiple languages, how do you prepare to give a talk or a presentation that is not in your native language? And how do you tackle the anxiety that comes from that?
Yes, this is an extra point of nerve that the non-native speakers, as me, always have when they're doing a presentation. And I always say to the people, when you think about the key opinion leaders of the EAU, I can say many names here. I can say Morgan Rupre, I can say Maria Rival, I can say Alex Motri. All of them are non-English native speakers. So don't be afraid of talking in your non-native language because people will understand you. And English, compared to other languages, is very easy to speak and to make it comprehensible. You, Nikita, you are a native speaker, so probably, I don't know if you can endorse what I'm saying, but I think, of course, practicing and feel confident, but people won't judge you for your accent or people won't judge you for your mistakes in grammar. I think the important is to deliver the message and to make it comprehensible.
Absolutely. Well, I'm not exactly a native speaker because I'm from India and I do also speak 3 different languages. So I can get nervous as well talking in English sometimes. So that was very good. Thanks, Juan. So moving on, I think you kind of touched on this already about your audience, but when you are a junior trainee or a resident and you are presenting in front of a senior leader in that field, so you're doing an abstract presentation about your research, and you feel quite intimidated, especially when you're tackling questions. How would you suggest managing this intimidation and also preparing for questions? Because questions can come out of anywhere. And I think that's something that everybody struggles with. What am I going to be asked at the end of the presentation?
I think in the presentation, the question part is what makes us human. When you are presenting, you want everything to be perfect. You want everything to go and run smoothly, but we are not robots. We are not AI. So we do not have the reply of all the questions in the world. And you don't know where the question will be come from. So the very first thing to think here is, as I said before, when you are selected to give in a presentation is because whoever organized the presentation trusted that you are the one that needs to deliver the message. So you are the most important voice, let's say, of whatever topic you need to do. That's the first thing. The second thing is we are humans. We make mistakes. No problem at all. If someone makes a question and you don't know how to reply, it's very human to say, I don't have the reply for that question now, but I can come back with you later, or we can discuss further after the presentation. Usually when someone makes a question, I can say that 90% of the people knows the reply. So many people that ask question, they already know the answer. So it's not really a question. It's like wanting to show themselves and say, okay, I also know about the topic. And we need to deal with that. We have that kind of people everywhere. So first of all, when they ask a question, they usually know the answer. Probably you can send the question back and say, okay, you as an expert probably have more experience than me. What had happened in this case, or what is your experience on that? We are humans. We are not robots. We are not artificial intelligence. So no problem to say, I don't have the reply. I don't have the answer. I will go back later. And people will understand it.
Yeah, absolutely. I think saying I don't know is always a good option when you actually don't know. Moving on from sort of delivering the talk to the content of the presentation, can you recommend how would you drive your presentation? So in terms of content, the start, presenting the results, and then driving home the conclusions and the take-home message.
When you are giving content to your presentation, regardless of time that you have, you can have 5 minutes, you can have 7 minutes, you can have even, 1 minute or 15 minutes. Regardless the time that you have, your presentation have 3 parts. has an introduction that I think the introduction should be impacting because it's the first 1 minute or the first 7 seconds is the first part of your presentation and is where you have the opportunity to catch the audience. If you don't do a nice introduction, the audience will be lost. So the introduction is very, very, very important. Then, of course, you have the conclusion or the take-home messages. For the conclusion and take-home messages, the people needs to have something to take home about what you have said. And inside the content, I usually split my presentation into 3 blocks. And in those 3 blocks, you can put in or put out depending on the amount of time you have to deliver your presentation. So in a summary, first introduction, you can introduce yourself if no one has introduced you before. Of course, you have to thank whoever has invited you there. And then I usually start with an image, a personal history, a video to make an impact and to catch my audience. Then the content should be delivered into 3 blocks. And then at the conclusion, people needs to have a message to go home. I give you an example. I want to deliver you the message to come to Spain to spend your best vacations in your life. I can start my presentation, big picture of a very nice beach in Spain. And I can tell you, are you stressed? Are you tired of working? Why don't get a plane and come to visit this beach in Spain?
Yes, please.
Okay, I got your attention. Then I need to give 3 blocks. For example, I can convince you to come to Spain because the food is nice. I can convince you to come to Spain because the beach is nice. Or I can convince you to come to Spain because the weather is nice. Those are the 3 things that I want you to get home. That you need to come to Spain because our beach is good, because our food is the best, and our weather is the best of the south of Europe. And then, depending on the time, I can explain you, okay, you can go to the south, or you can go to the north, or you can eat seafood, or you can eat paella. Depending on the time left, I can give you more content or not. Because this is something that we also might fail. We always think that what we need to deliver, everything is important. Everything is important because it's our work, it's our research, and all the data, all the numbers that we have, everything is important and everything needs to be delivered. And that's not. You can deliver the very important message, and then you can leave something for the discussion.
That's golden words. I think I'm going to use this in my presentations now on. I definitely am guilty of overloading my presentations, like you said. So this is very, very important advice for everyone. And then sort of moving on to how do you create your presentations? Do you use any special software? There's a lot of talk going on about using AI for generating presentation slides. Have you got any experience in this at all?
For the presentation itself, I'm very conservative. I use PowerPoint. I do not use any fancy software. I use in my presentations many videos, not only surgical videos. I also use videos from movies and videos that I always get from YouTube. You can download them, or you can just use your screenshot or screen recording for the videos. And I myself use PowerPoint because, as I said, I'm very conservative. I know that there are many softwares around. Regarding AI, I haven't used AI to create the presentation, but I have used AI to see the content to be filled inside the presentation, especially when I need to create a new presentation. Usually when you are invited to lectures, you do recycling of lectures because it's a topic that you already know and you need to update some slides. But when I need to create a presentation from the scratch, from zero, I sometimes have used AI to see what needs to be filled inside the presentation. And of course, then I go to scientific engines such as PubMed or Google Scholar, Medline, to create a scientific presentation.
Yeah, that's a very good point. I'd like to chip in there because I used ChatGPT to make a presentation. I think I was invited at the AUA last year to talk about the top 10 urology contributions of America. And I used ChatGPT initially to find these out. And as I was making my presentation, I realized that a few of them were fake. So ChatGPT sometimes does provide you with data that may not be exactly scientific. So you have to go back and check, like you said, on Medline to make sure that the content that is being generated from AI is actually scientific. But otherwise, yeah, great tool to get some content at times. So sort of now moving on from presentation content to delivering the presentation again. And this time I want to talk about sort of non-verbal cues or body language that convey confidence. I look up to Declan Murphy and his sort of presentation style, and I think I'm a million years away from that. But like he talks like a news leader, doesn't hide behind the podium, and he's always sort of, even when he's recording his presentations, he is very confident in the way he delivers them. What would you suggest are your sort of nonverbal cues or body language that you use to convey confidence while presenting?
That's very important, Nikita, and I agree with you. We are very far away from probably presenting as Professor Declan Murphy, because for that you need to be born with special gift and to have that way of presenting, but we can be close, let's say. For that, we need to improve our nonverbal communication, which is delivering a message without using any words. And of course, that includes physical appearance, includes the body language, includes the way you move your hands, right? And it's very important because all these movements that you do, your hands movement or your eyes movement or your body movement, needs to be assembled with the message that you are delivering. It's difficult to explain in a podcast because we don't have videos here. But of course, if you use your hand to say 1, 2, and 3, that is non-verbal language. And that's easy to understand. What you not need to do is to do some random body shaking or hands movement, because that will show that probably you are very nervous. So you have to have, of course, a good attitude, a good posture, always smile. Eye contact is very important because sometimes we are looking at the slides or looking at the screen and we forget completely to see the people that we are giving the presentation. So eye contact is very important. We have some don'ts also. For example, having a negative posture, such as crossing your arms or putting your hands inside your pockets. That is not good. I think the hands are very nice instrument that we have to make a nice body language.
Yeah, absolutely. I think a lot can be conveyed by the way you deliver your presentation non-verbally. So key to practice again, as you said before, in front of the mirror, maybe to look at how you're talking as well would be useful. And now let's talk about some different kinds of presentations. So, of course, the sort of more generic presentation is where you're talking to an audience live. You can see your audience, like you said, make eye contact, get some audience feedback. But let's talk about virtual presentations. You're very experienced in delivering all kinds of presentations. So what is your experience with virtual presentations, and how do you manage this differently from a live presentation?
That's a very good point, and it's a point that also have been very popular after COVID-19. We have moved a lot to virtual presentations. And I think the main problem of virtual presentations is that you do not know the feedback of the audience, because you are speaking into a screen. You don't look to the audience, so you don't know if they are sleeping, if they are eating, if they have gone somewhere. So getting the feedback of the people is very difficult. From my side, for a presentation that is online, I do not prepare differently. I usually use the same kind of slides. I usually use the same kind of a speech, but this is a challenge for us. Sometimes it's difficult to know if the people is in touch with you and is in touch with the presentation. You can insert in your presentation some polls, for example, because there are some softwares that you can use for doing audience polls. In that way, you make sure that at least some percentage of the people that is listening is getting with you inside the presentation, because you are using their opinion and then commenting them. This can be one tip and trick that you can use in your presentation. But from my side, I think it's very challenging to get the feedback of the audience when you're doing virtually. I don't know about your experience, Nikita.
Yeah, I find it quite disconcerting as well, talking to a blank screen. A lot of people, like you said, turn off their cameras. So you're literally talking to yourself and getting no feedback. I think the key again comes back to practice, practice, practice. So the more virtual presentations you do, you start understanding that this is how it is, and you kind of start getting used to it. But I think, like you said, don't get phased and try to include some interactive slides, questions, maybe or have an interactive Q&A open on one side so you know that there's some feedback coming. But otherwise, you can request the audience to turn on their cameras if you're doing a teaching presentation, for example. So the next question is leading into doing a teaching presentation then. So obviously you're an academic, you're a professor, so I'm sure you do a lot of teaching for residents and medical students. How do you prepare for a teaching presentation, and how is it different from presenting your own research?
Of course, when you are preparing a teaching presentation for the university, for example, the content is different. You have to think that when you are giving a presentation to people, to students, most of them won't become urologists. Most of them will become cardiologists, plastic surgeons, traumatologists, general surgeons, or I don't know, internal medicine, family medicine. They won't become urologists. So whatever you are saying and whatever in your mind you think is important, for them is not. For them, what is important is to pass the exam. So you to give them tips and tricks, or what is important to pass the exam and go to the next matter or the next subject that they have in the university. So the presentation needs to be completely different. You cannot put inside a presentation for medical students with so much data, with so much hazard ratios or odds ratios, or with too much Kaplan-Meier curves. So the content should be very simple. You need to deliver them what they need for their daily life. And the language that you use, of course, at the same time, cannot be so technical. It has to be more common. They can understand what are you explaining to them.
But I think sometimes talking simply is more difficult than talking in a more sort of complex manner. So I think you make it sound easy, but actually making any complex topic simple is very challenging. And I'm sure you're excellent at that. Thanks very much for today, Juan. Is there anything else that you would like to add from your side about presentation and communication skills?
Nothing much to add, just to remind the audience or the listeners to this podcast that the expert in everything was once a beginner. We didn't born with the skills, we didn't born with the knowledge, but working hard and staying positive, you can make things happen. And I hope that all the tips and tricks that we have works for you in the future in your presentation skills.
Excellent advice. Thank you so much for your time and valuable insights. I hope many people, including myself, will feel far more confident with presentations after listening to this podcast. And good luck with your presentations in the future. Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.